Morning consultants, senior registrars and medical officers present. I am Dr. Pascal. I'm making a presentation on otitis media and otitis externa. These are my outline. Introduction, from introduction to anatomy, classification, etiology, risk factors, and to reference. Anatomically, the ear is the organ of hearing and for balance. The parts of the ear include the external or outer ear, consisting of pinna or auricle, the external auditory canal or tube, tympanic membrane or eardrum. The middle ear consists of the tympanic cavity, which consists of the ossicles, the malleus, the incus, and the stapes, the eustachian tube, and then the inner ear consists of the cochlea, vestibules, and the semicircular canal. Otitis externa is an inflammation or infection of the external auditory canal, the auricles, or both. It's also referred to as swimmer's ear or external otitis. It results from the exposure of moisture. It occurs most commonly among adults, however, also occurs in children between the ages of 7 and 12, and also in the elderly. Epidemiologically, in a study done in Port Harcourt between 2017 to 2019, the prevalence of otitis media was around 28.77%. Out of this, there were 54 females and 45, there were 54% of females and 45% of males, making up a ratio of 1.4 to 1. The age group ranged between 21 to 30 years, which actually the age which was most affected. And then chronic otitis media was the commonest seen in this study. Otitis externa can be classified into acute diffuse otitis media, acute localized otitis, acute diffuse otitis externa, acute localized otitis externa, chronic otitis externa. Can also be classified into eczematous otitis externa, necrotizing otitis externa, and otomycosis. For acute diffuse otitis externa, is the most common form of otitis externa typically seen in swimmers with rapid onset within 48 hours. While acute localized otitis externa, also known as furunculosis, is associated with infection of a hair follicle. Chronic otitis externa is also same as acute diffuse otitis externa, but is of longer duration, greater than 6 weeks. 6 weeks. While acute diffuse otitis externa is less than 6 weeks. Eczematous otitis externa encompasses various dermatologic conditions. For example, atopic dermatitis, psoriasis, systemic lupus erythematosus, and eczema. Necrotizing otitis externa, also known as malignant otitis externa, is an infection that extends into the deeper tissues adjacent to the external auricular canal, occurs primarily in immunocompromised adults, such as diabetic patients and patients living with HIV/AIDS. Otomycosis is an infection of the ear canal from a fungal species, commonly the Candida or Aspergillus. For the picture representation, we can see the normal ear, we can see the otitis externa, the acute otitis externa to the otomycosis. Pathophysiology, this can be divided into 4 categories. One, obstruction. Second, the absence of cerumen, trauma, and alteration in the pH. For obstruction, this involves the cerumen building up within the ear canal and narrowing of the tortoise canal, resulting in water retention. And then absence of cerumen may occur as a result of repeated water exposure or overcleaning the ear canal. Trauma can also allow for invasion of bacteria into damaged skin, and then alteration in pH of the ear, which is normally within pH of 5 to 7, 3, 5 to 5.7. Alteration in this can also lead to infection and causes otitis. Ethologically, otitis externa is most often caused by bacterial pathogens such as the Pseudomonas species, which accounts for about 38% of all bacterial cases. Also, Staphylococcus aureus, Streptococcus species, and Pseudomonas are the commonest cause. For fungal, Aspergillus is the commonest fungal cause, accounts for about 80 to 90%, followed by Aeruginosa and the Candida albicans. Also, objects in the ear can also be a focus of infection. Cotton wool or other small objects that are introduced into the ear, such as hearing aid or earplugs can also cause trauma and then infection, traumatize the ear canal. The common risk factors for otitis externa is swimming, diving, or participating in aquatic activities or sports, or patients who have had previous episodes of otitis externa. Use of earplugs or probing of the ear canal can result to secondary trauma, accounting for causing acute otitis externa. Humid weather, hot weather, use of hearing aids, or even patients who have eczema, allergic rhinitis, or asthma can have a higher risk of coming down with otitis externa. Comorbidities such as diabetes, mellitus, AIDS, or malnutrition can pose as great risk for this. So the clinical features they present with are erythema and swelling of the external ear canal, Otalgia, worsened by movement of the jaw or pressing of the tragus. Patient can also present with purulent ear discharge, eczema of the pinna, periauricular adenitis, long and white filamentous hyphae growing in the skin of the ear, and there's even soft tissue stenosis. These are the common features they present with. On examination, good history and physical examination usually provide sufficient information to make a diagnosis of otitis externa. Ear examination with otoscopy can show swelling, deformity, and erythema, and even masses within the external auricular canal and arteria as well can also be seen. And also examining the part of the tympanic membrane will show us pars tensa and also pars flacida, which are pointers to infection. Then also assessing the motion of the tympanic membrane by means of pneumatic otoscopy is also a very good examination procedure to do for these patients. So the investigations we do, however, most patients with otitis externa are treated empirically before we commence our examinations. However, it's important to note that laboratory studies are not typically needed and imaging studies are not required for most cases of otitis externa. But however, when they present with discharge, we can also do our swab MCS, microscopic culture sensitivity. We can do our full blood counts, HIV test, blood sugar check to rule out comorbidities. We can also do our urinalysis for patients who can afford it and centers that have the machines. We can also do a high resolution computed tomography, CT scan of the head, MRI of the head, and even radionuclide scan. But commonly, we do our full blood count and baseline investigations, full blood counts, blood sugar, and the rest of them. The goal of treatment is to stop the infection and allow your ear canal to heal, avoid getting affected with wetness within the ear, remove any discharge debris by gently swabbing out outer ear with cotton wool. Also try to remove everything and or anything from the affected ear which may cause an allergic reaction, such as hearing aids, earplugs, earrings, Debridement or removing infected debris should be gently and thoroughly removed from the canal with suction or dry cotton wool swabs under adequate lighting. Painkillers such as ibuprofen and paracetamol can also be given to the patient to manage pain. Antibiotics plus corticosteroid ear drops is